All right, Dr. Jeffrey Gerdes here, Carolina ChiroCare and Rehab, your neck and back pain relief experts. We're here with our patient today. You've been having some neck pain.
Yes.
And it recently started shooting down into your left shoulder. Tell us what happened and how did all this start?
So I've been an athlete pretty much all my life. I've been in sports, I've done basketball and gymnastics, and I feel like I've suffered from that ever since. But the last couple of years, I have been dealing with lasers because I'm an esthetician, and I felt like it's gotten worse and worse, and then I feel like I have a pinched nerve as well.
Okay, so you're using your shoulder a lot, you're bending over your clients,
Yeah.
and that's causing a lot of tightness and pain in the upper part of your back, your neck, and your shoulder.
Yes.
So we're able to get some x-rays, and it looks like you're losing some of the normal curve in your neck. So typically this would kind of come down like this and then curve around this way. So you can see some of the postural deviations that you're having with the curve in your neck. You know, in some people this can start to cause dysfunction and neck pain, headaches, and some irritation on the nerves also. So we're going to recommend some neck exercises as part of your treatment to see if we can kind of tighten some of the muscles in your upper back and your neck. If we could kind of pull this back a little bit, I think it'll give you some good relief as well.
Okay.
To try and be a little preventative in the future. So
Okay.
sound like a plan?
Yes.
Okay, great. Up all the way. Cough really hard. Is there pain with that? Come this way. Cough. Cough again. Does that hurt? All the way back here. Look up again. Cough. No neck pain, head pain. Bring your shoulders up like this. Don't let it press down. Resist. Does that hurt? Put your wrist up. Go like this. Good. Don't let it press your wrist down. Good. Resist. Push up. Good. Push up. Good. And then bring your wrist down. Good. Nice and strong. Push your wrist down. Good. Feel like you're losing any muscle strength?
No.
No? Okay. Push down again. So bring your wrist down. Don't let it press up. Hold your hands out. Don't let it press your hand down. Good. Muscle strength looks good. Let's take a look at your neck here. Can you lay face up on the table? So you feel like the pain is coming from the middle of your neck, top, or bottom?
The majority is like tightness and pulling all over, but I've got a specific pain on the left. Yeah, radiating from my neck to that shoulder.
Okay. Your coat here.
Okay.
Great. One, two. Very good. Give yourself a big hug. Very good. The last one was a little tight. Okay, let's go face down for me, please. She has a large knot in her upper trapezius muscle here. Is that tender?
Yeah,
Okay.
but it doesn't hurt.
Doesn't hurt. Okay. Take some big breaths in and out. Big exhale, big inhale. Feel these muscles. Just finished with her chiropractic treatment. Now we're going to get her started on her physical therapy with some muscle stimulation and some cervical traction to see if we can bring down her neck and nerve pain. So we just finished up the chiropractic treatment and the physical therapy. Your pain was about a 7 out of 10 when it came in. How does it feel now?
It's about a 4 or 5.
4 or 5. Okay, so that's some pretty good relief. We're all finished. We got her on some exercises for her postural problems that she's having in her cervical spine. She's going to keep up with those. And it's Dr. Jeffrey Gerdes here, Carolina ChiroCare and Rehab, neck and back pain relief. Thanks for watching.